Expectant moms have a lot to think about, but thanks to advances in both practice and technology, welcoming a child into the world is actually easier than ever. So joining us today is Dr. Rabiya Suleman, a board-certified OBGYN with Overland Park Regional Medical Center. Thank you so much for stopping by.
Thank you for having me.
I can tell just by what reading I've done about this, so much has changed since I went through this process 20-some years ago. And now you're talking about the use of nitrous oxide. That's laughing gas, right?
Yep, it is laughing gas.
So how do you use that?
So laughing gas has actually been around for decades. You know, it's the same gas that you use in the dentist's office, but here in labor and delivery now we can self-administer it during labor to help ease the pain of contractions.
Okay, so when do you use it in conjunction with other things or maybe on its own?
So you use it on its own until you get to the point where you need something else, but they set it up for you and you inhale while you're having a contraction, and it helps to ease the pain of your contractions.
So they call it laughing gas, is what dentists have always called it. Is there laughing going on in the labor and delivery room there?
So just having a baby a few months back, I used it.
Congratulations.
And my husband happily has videos of me cracking up laughing in the middle of having contractions.
Is that right?
Yep.
Now, so in your experience, let's just go with that. Is that all you used, or did you go ahead and have like an epidural at some point?
I did. After it took the edge off contractions in the beginning, but after a while I did want my epidural, and so I asked for it. At that point, I was not able to use the nitrous oxide.
I see. Okay, very interesting. And I've also read a lot about this new gentle C-section. So what is that?
So the new gentle C-section is we use a clear drape. And before, back in the day, you were not able to see your baby or see your baby come out of the belly.
Yes, because you were kind of shrouded.
Right, so you had a completely blue drape, so you couldn't see anything. Now with the clear drape, as soon as the baby is delivered, mom can actually see the baby come out of the belly. Also, we put baby right on her chest immediately. Dad can cut the cord through the clear drape.
Like with a vaginal birth.
Yep.
Same way.
Same way, except not touching the scissors, but through the clear drape, he can cut the cord. And then as long as baby's doing okay, we do immediate skin to skin in the operating room. So as soon as baby's disconnected, baby can come right to mom and be right on her chest.
Which so many studies have proven is so vital for that bonding to start immediately. Okay, last question. I had to save the best for last. You say you use this peanut ball. I thought maybe it was some sort of protein thing, but it's not. You use this in the delivery room now, this peanut ball.
We do. So the peanut ball is, imagine a yoga ball that's shaped like a peanut. And they're different.
It's a little more oblong.
It is. It's long and it's got two kind of larger sides at the end, and then it's a little smaller in the middle, and it's matched up for people's height. And so you use the one that's appropriate for your height, and it goes in between your legs. And so using that, it helps to open up the pelvis, and it helps to guide the baby's head down into the birth canal.
How often do you use that?
As often as we can.
So you like it?
I do.
As a tool in the delivery room?
It really works well.
Isn't that fascinating? All these new things just in the last couple of decades. Thank you so much for stopping by, and congratulations once again to you personally. Hey, if you want to see more from HCA Midwest Health, you can find more helpful segments just online. Go to kctv5.com/HCA Midwest.